Attorney General and Minister of Legal Affairs, Honorable Nandlall, said the unconstitutionality of the former administration for over a year has led to a troubling situation for the current administration.
The new PPPC government has hit the ground running, taking care of the nation's affairs. On his first Government in Focus interview recently, the Attorney General revealed that following the successful passage of the no-confidence motion, the former administration led the country with no respect for the Constitution. Since then, the AG said the constitutional character of the country was changed. Following the passage of the no-confidence motion, the then government was expected to call elections within 3 months, while the administration, including the cabinet, was also expected to resign. However, that was not the case.
All those time frames were tossed aside by this administration, the previous administration. Just tossed aside. After that, Guyana began to run on an unconstitutional or at least an extra constitutional track. Because if those constitutional events do not happen, then the whole constitutional equation breaks up. And when that happens, then the country goes awry. So the government of Guyana became illegal by March 21st or thereabouts of 2019. The CCJ is our highest court, and they made an order saying that the 3 months that they had began to run from the date of the CCJ's judgment. I think it was June the 18th, I can't remember. And so by September the 18th, the 3 months would have expired. So they were given a lease of life again to September the 18th. Again, they did not comply. And therefore, they became doubly illegal if there is such a concept. After that. And then they didn't even hold elections until March, another 3 months. So they took an entire year.
He said governments are usually governments by law. The last administration, however, was a government by edict, he said.
All the time frames that our constitution has in place for events to take place in a calendar year, all have been violated. So the time for the dissolution of Parliament was messed up.
With an illegal government in place, the passage of a budget will be impossible. The absence of a budget, however, will allow the government to use a fraction of the previous year's budget.
So they were using monies from the previous budget, but beyond the 90-day period. And the Constitution also says that you can only use it for continuing the ordinary activities of government. Now, in other words, you can't go build a new hospital. That's a capital project. That's completely illegal. So, all these violations continue up to today.
Getting back on track constitutionally, the Attorney General said, will mean the new government has to understand the status quo of the country. So far, the PPPC government found that the Guyana Forestry Commission is bankrupt. This is even after leaving a $4 billion surplus in the Treasury in 2015. Millions of dollars are also missing from the Guyana Geology and Mines Commission, while the funds from the Department of Housing have also disappeared. The Lotto Fund has been virtually depleted, while Central Bank has seen a deficit of hundreds of millions of dollars.
All the macroeconomic signals are signaling distress in every facet of the economy. So we are coming to grips with that now because you have to pass a budget. How do you pass a budget if you don't have an assessment of your financial strength? You can't go and budget for money that you don't have. Budget to spend money that you don't have. And you have a hell of a time finding where the monies are. Imagine when we left government, we give these people all the bank accounts with billions of dollars, and we were accused. of hiding these monies in commercial banks when we deliberately open the accounts in commercial banks so that we can put money at the disposal of commercial banks, state monies, to put into the banking system to enhance lending.
The Attorney General revealed that all the bank accounts are empty with nothing to show.
You will hear the Minister of Public Works will report soon on the state of the airport. And that's our project. What they did to that project was they renegotiated. They ended up in a smaller project, smaller airport, at a higher price. The East Coast Road, that's our project. Our project approved before we left. And those are the two major infrastructure projects they've done. The West Coast Road, if you can remember, that project was signed under our government. The Breeden Hoop to Parika Road. That's the other major infrastructure project. They have done nothing. And they have emptied the treasury and all the account monies that we had in the various funds.
The Attorney General related that the country's accounts are in disarray. Monies that were supposed to be approved by Parliament before spending were not given that approval.
These guys have been going into the treasury as though it is their private safe at home and just pulling down money. $1.6 billion spent on what they're calling a hospital, and there's not a bed in the hospital. And now we are being told by some company that they own the hospital. They own the property that's not even the government. And the government owes them rent. I mean, what level of crazy you have to be to spend $1.6 billion on a property that you're not sure that you own?
Meanwhile, Minister of Health, the Honorable Dr. Frank Anthony, revealed his ministry has been challenged by suboptimal operations. This was revealed after the new health minister had carried out an assessment of the ministry.
This is very distressing because it would have meant that in some areas and for some of the diseases that we were trying to bring under control, if you didn't do any work for several months, then these things can easily increase. And that's something that's a trend that we are noticing.
A quick assessment of the ministry and the task force established to address the coronavirus pandemic found that it was highly political.
If you're managing a pandemic, what you need is political will and leadership, but you have to get the technical people to lead the process, and people who understand infectious disease and infectious disease control so that you can have the technical things being done. Unfortunately, I think a lot of that was missing because when you politicize the task force, you don't get the same results as if you had a blend or a mix of technical people with some of the policymakers. And that was one of the big mistakes, I think, that the past administration did. And because of that, maybe the vision of how to deal with some of the problems, they weren't able to successfully do that.
Turning his attention to the $1.5 billion infectious diseases hospital, the new health minister reported that an assessment team had visited the building recently. It was discovered that there was an immense threat to flooding.
We sent a medical team in to look at the actual facility and to see whether or not it can be used and what is necessary for it to be used. They had, in their minds, they had 197 beds that they were looking at. And of those 197 beds, you have, maybe we can categorize them in three groups. One is ICU beds, right? The second would be high-intensity beds, meaning that you don't meet the requirements for ICU, but you're still critical, so yes, you need this type of bed. And then there's the regular bed, right? For the ICU area, we will need to ensure that there's oxygen and suction and those types of things. And generally, when you're making a hospital, those tubes to bring in oxygen and so forth are normally placed in the wall. This facility was rehabilitated they had the opportunity of placing those things in the wall because that also reduces transmission and infection spread and so forth. So you need to have these things in the wall. That was not done.
In the event the ministry now wants to use the facility for its intended purpose, Dr. Anthony explained that extensive work will still have to be carried out on a number of areas.
There are lots of things that really you just have to wonder how such blunders were made. And you can only call them blunders, I don't know, I don't have the vocabulary to describe some of these things that we have been picking up.